Hi, it's Dr. Centeno, and I'd like to get into a common DMX finding that we see all the time, which is retrolisthesis, and whether or not it can be helped. And to help that, one of the physicians in our office, Dr. Pitts, developed what I call the tALL procedure. So let's go through that. The tALL procedure is transcutaneous anterior longitudinal ligament procedure. You can see Dr. Pitts doing it there. It's actually both under ultrasound and X-ray guidance. And it focuses on the anterior longitudinal ligament, or the ALL, the piece of duct tape in the front that prevents one vertebra from going backwards on the other. Now, the ALL and cervical disc prevents that extension of one vertebra on the other based on the peer-reviewed literature. So who is perfect for this procedure? Well, the patients that you find that have that retrolisthesis, and it seems to be symptomatic at that level. So for example, they've got a 5'6", 3 millimeter retrolisthesis, and at the same time, they seem to have symptoms related to 5'6". So that's a perfect patient for this procedure. And this is what the procedure looks like. Again, it's X-ray guided and ultrasound guided. The focus is getting that anterior longitudinal ligament. And we use both AP and lateral X-ray views as well as ultrasound to make sure we're going in the exact right spot. We're injecting bone marrow concentrate, or the patient's own bone marrow stem cells, to heal that anterior longitudinal ligament. So in summary, this tALL procedure can treat symptomatic retrolisthesis, is found on DMX or flexion extension X-rays. We perform this procedure at the Centeno Schultz Clinic in Colorado. It takes a lot of skill to do it correctly and not obviously injure the patient, because you've got important stuff up front there that you have to miss. But if you do it the correct way, we've seen great results with this procedure. We've seen resolution of that retrolisthesis. And so we're happy to see your patients. And again, the perfect patients are those people walking in who have that symptomatic retrolisthesis. You're finding it on DMX, and it's probably a good idea to let those patients know that if that's causing their symptoms, and maybe let the referring provider know that if that's causing their symptoms, there is a treatment for that that does not involve a cervical fusion, because obviously that's the other step. So thanks so much for watching. I hope this information is helpful for you and your patients. Thank you.